Hello doctors, welcome to Docshala. In this video, we are going to see about non-parametric tests that we use in statistic analysis in community medicine or community dentistry. So we'll just look at what are the tests we use. So what is a non-parametric test? The test is the techniques that do not rely on any particular distribution of the population or the variables that we use in the test. So they do not rely on any particular distribution. So it does not mean that the model has no parameters, but that the number and nature of the parameters are flexible. So the number and nature of the parameters in non-parametric tests are flexible. So the opposite of this is parametric test, where the everything of this is opposite, like it has a particular distribution, it has a particular parameters which needs to be followed, but in this we don't follow any kind of parameters. So the sample distribution is unknown. Since we don't follow anything, the sample distribution we do not know. So when population distribution is abnormal, that is too many variables are involved, then it is known as a non-parametric test. Then it is used in, so where is it used? It is used in making decision or forecasting. So forecasting means we do something which might be the truth in the future. Okay, we do some analysis for decision making which will affect the future. So that is what we do with this test. And studying populations that take on a ranked order. So ranked order populations. So for example, movie reviews. So we review a movie like based upon the stars that people who have seen the movie has given it, like we segregate it from 1 to 4 stars, and we'll see how much percentage of people have voted for 4 star or 1 star. So we'll see the greater percentage that they have voted. So based on that percentage of population that it has voted, we'll review the movie as whether it is good, bad, average, or whatever it is. So in this we know that the population distribution is wide. So it is very wide. We don't know whether the range of the population that it is covering. Okay, so in such cases we use a parametric test, and it is also used well to make a simple analysis. Okay, then coming to the commonly used tests. So since it involves so much variables, so much huge numbers, so we have a huge number of tests also in this. So as you can see the list here, so the list of tests which we use in non-parametric method are Chisquare Test, Nemar Test, Sign Test, Wilcoxon Signed Ranks Test, Mann Whitney U or Wilcoxon Rank Sum Test, kruskal Wallis or H Test, Freidman Anova, the Spearman Rank Correlation Test, and Cochran's Q Test. Okay, so these are the tests that we use in non-parametric analysis. So you just have to make a note of it. Then coming to identify this person. Anyone? Let us see. So we are now going to see about Chi-square test. So this person is none other than Carl Pearson. So he was the first person who used this chi-square test. So it is the simplest and most widely used non-parametric test in statistical work. So it revolves around this formula. So this is an important one. So this is the chi-square. So this is the main parametric, is equals to sigma into O minus E whole square by E. So what is it? So what is O? What is E? Sigma is the sum of all, right? What is O? What is E? So O is the observed frequencies and E is the expected frequencies. So we'll see what it is. Okay, observed frequencies is nothing but we do it by calculating based on the information that we have. This is expected frequency is some random expectation. Okay, random expectation, we do this. Okay, so greater the discrepancy between observed and expected frequency, greater is the value of chi-square. So the calculated value of chi-square is compared with the table value of chi-square for given degrees of freedom. So that will help us in knowing whether what we have expected is true, false, or it doesn't, or negative. So based on that we do that. Okay, so applications of chi-square test. So where it is applied to know the test of association between two variables. So variables, what kind of variables? So we use it like, so for example, whether we have two variables, smoking and cancer. So we can use it to measure the thing whether really smoking and cancer are associated. So how far it is associated. So treatment and outcome of disease. Okay, how far it is associated. Vaccination and immunity, how far it is associated, like what is the effectiveness of vaccination to provide immunity. So such kind of associations we can calculate from chi-square test. And test of proportions, we compare frequencies like of diabetics and non-diabetics. So we compare frequencies of non-diabetics and non-diabetics based on the groups of weightage, like 40 to 50 kg persons, 50 to 60 kg persons, 60 to 70. It's random surveys we do. So we just test the proportions there. And for goodness of fit, so for goodness of fit, determine if actual numbers are similar to expected or theoretical numbers. So that is what I have told in previous slide also. We try to that original frequencies and observed frequencies and in expected frequencies, what we do is whether we just do perform the test to know whether the actual numbers are similar to the expected or not. Then test of independence and also test of homogeneity. So we use for this purposes. Okay. So example. So let us just take a small little bit of example here. So a randomized trial is being performed to compare the incidence of bradycardia after phenylephrine versus norepinephrine. So bradycardia, what is the incidence of bradycardia after administration of phenylephrine and after administration of norepinephrine. So we are going to compare between these two to prevent and treat spinal induced hypotension in women undergoing cesarean delivery with spinal anesthesia. So why are we performing this test? To prevent spinal induced hypotension where in women who are undergoing cesarean delivery with spinal anesthesia. So according to the Pierce and chi-square test, it evaluates the null hypothesis. So according to null hypothesis, what it is basic null hypothesis, what it is whatever we are hypothesizing. So whatever we are hypothesizing means whatever we are telling, like I expect this from this is equals to 0. So that is what is null hypothesis. Okay, so according to null hypothesis in this example of chi-square test, the two categorical variables, so categorical variables that we use here are treatment group. Okay, treatment group example. So treatment we are giving it with phenylephrine or norepinephrine. So it will be norepinephrine versus phenylephrine. And the outcome group is whether we are getting bradycardia or not. So whether we are getting bradycardia or not, and whether these two variables like treatment group and the outcome group are associated with each other or not, that is what we are going to see. So then like hypothesis of chi-square test is that no relationship exists on the categorical variables in the population, so they are independent. So this is what the null hypothesis in chi-square test says. So there is no relationship between categorical variables and they are independent. So this is the table where we can see the values that are being depicted, that have been observed, so and expected. Okay, so here you can see observed number and expected number. So they have divided like phenylephrine and norepinephrine. So when they have divided this, so you can see this observed number 21 people with phenylephrine administration have developed bradycardia, 6 with norepinephrine have developed bradycardia. But what we have expected 13.5 people and 13.5 here. So the observed number with phenylephrine is way higher, right? Then with no bradycardia, what we have expected, at least 42.5 people will not get bradycardia despite of the administration of phenylephrine or norepinephrine. But all in the when after performing the survey, we have observed that phenylephrine is giving 35 and norepinephrine is giving 50 with no bradycardia condition. Okay, so that is what we have observed. Okay, so this is the total. Okay, 56 it is a total of this. Okay, and this is the total of this. Okay, this is the total of expected number. Okay, this is the total of observed number. Okay, so the reported p value of 0.01 suggests that it is very unlikely to observe a difference. Like this is larger or larger if the null hypothesis was true. So null hypothesis, what according to null hypothesis, there is no what we did, like there is no comparison between treatment and outcome group, so it should be 0, but here it is not 0, right? There is a difference. So if it was 13.5 in the observed number here or 13.5 here, it would have become 0, and the test would have told that what we have hypothesized is not correct. But here the values have changed, the observed numbers were changed, so the null hypothesis becomes false, right? Supporting the conclusion that there is an association between treatment and outcome. So this is supporting that there is an association between treatment and outcome, right? Then coming to Nemar test. So it is used to compare before and after findings in the same individual, okay, or to compare findings in a matched analysis. So example, comparing attitudes of medical students towards confidence in statistics before and after intensive statistics course. So the same individual or matched analysis. So for example, we have took a course, we have given a course to a group of people, and we are comparing the attitudes of confidence, like how much they have gained confidence regarding that subject. So something which is very like particular to a small group of people or small this thing. Okay, then coming to the sign test, it is a statistical method to test for consistent differences between pairs of observations. So consistent differences between pairs of observations. So pairs of observations means we have two different pairs, okay, which we observe. So what are the consistent differences? Consistent differences is that long-term differences, right? So it is simple and easy to interpret, makes no assumptions about distribution of data. So it makes no assumptions because we are looking at consistency. So consistency, when we are looking like consistency, like what consistency means, like every year you are getting a A grade, that means you are consistent towards your studying, right? But if every year you are getting different grades, like one year you get A, one year you get D, one year you get B, then you are inconsistent. So that is what. Okay, the null hypothesis for the sign test is that the difference between medians should be 0. So what is a median? Median mode, we know, right? We have like values 1, 2, 3, 4. So the median is like sum of the values by total number of values which we have, right? So that is a median. So difference between two medians. So two medians, why did two medians come? We have pairs of observations, means we have one set of observation and set of observations this is having two variables, and another set of observation which is having two variables. The median of this M1 and M2 should be 0. This is the null hypothesis for sign test. Okay, so the difference between these two medians. Okay, So calculation, the data should be from two samples, as we know. The two dependent samples should be paired or matched. Okay. For example, depression scores from before a medical procedure and after a medical procedure. So depression scores from before a medical procedure and after a medical procedure. That means we have two variables, that is medical procedure and depression scores, right? These are compared before and after. Okay, so this is one set, this is one set. Okay, we have two sets as we have seen. So these two sets, we'll be taking the values, we'll be taking the medians, and then we'll see whether they have followed the null hypothesis or there is a difference, and based on the difference we conclude the results. Okay, then coming to Fisher's exact test, it is used in the analysis of contingency where sample sizes are small. So it is used in the analysis of contingency where sample sizes are small. So when you have two nominal variables, you want to see whether the populations of one variable, proportions of one variable are different depending on the value of other variable. So it is very simple. Okay, two variables in a small thing, in a small size sample we are taking, and we are comparing both of them. Okay, then coming to Wilcoxon signed ranks test. So Wilcoxon signed rank test, what is this? It is a non-parametric test which is equal to the paid t test. So paid t test, this is a parametric test. So this is similar to that of equivalent, not similar, it is equivalent to that of paired t-test. So it is similar to sign test. It is similar to sign test which we have seen before, but taken into consideration the magnitude of difference among the pairs of values. Okay, in sign test we only take the direction. So direction matlab we take the consistency, like consistency we have seen. So it only considers the direction of differences but not magnitude. Like we don't see the volume of differences, we only see the direction in sign test. But in Wilcoxon signed ranks test we even see the volume. Okay, so let us see Mann Whitney U test or Wilcoxon ranks sum test. Okay, samples are independent and they are not paid. So samples are independent and they are not paid. Population means are same for two groups. Rank the combined data values of two groups and then find average rank in each group. So we rank the data, then U value is calculated. To be statistically significant, U has to be equal or less than the critical value. So we'll see what it is with the example. So we have a diet, right? We have two kinds of diet, Atkins diet and Jenny Craig diet. So we have 10 people following Atkins diet and 10 people following Jenny Craig diet. So we are seeing the differences between these 20 people. Okay, so 10 we have people following Atkins diet and 10 we have Jenny Craig diet. So hypothetically what we are expecting is that the Atkins group loses an average of 34.5 lbs, whereas the Jenny Craig group loses an average of 18.5 lbs. So according to this hypothetical result, what we can see, so we can see that the people who are following Atkins group have more weight loss compared to that of Atkins diet, have more weight loss than compared to that of Jenny Craig diet. So is this the correct one, the correct conclusion? So whether we are concluding it correctly or not, we are going to see that based upon the Mann Whitney U test or Wilcoxon rank sum test. So when individual data is seen, so Atkins change in weight. So these are the 10 individuals. These are the other 10 individuals. So first individual has gained 4 kgs. Second individual has gained 3 kgs. The third individual has no change at all. Then The fourth one, they have lose 3 lbs, 4 lbs, 5 lbs, 11 lbs, 14 lbs, 15 lbs, 300 lbs. So these are the values of 10 individuals based upon their weight changes over a period of time following Atkins diet. And when coming to Jenny Craig diet, so these are the values following the Jenny Craig diet. Okay, so after what we'll assign a rank for each, okay, of the weight. Okay, starting with 1 being the least weight loss. 1 will be the least weight loss, 20 being the most weight loss. So most weight loss from the values which we have seen is minus 300. So this person has lost the most of the weight, so he'll be assigned a rank of 20. Okay, the least weight is someone who has gained more weight. So this person plus 4, this has gained more weight, so we are ranking him 1. So the remaining people are ranked according to the weights they have gained or lost in the weights in the diets. Okay, so we have ranked them accordingly. So what we'll do, we'll after assigning the ranks, we'll sum the ranks. Okay, we have assigned a few ranks, we'll sum the ranks. Okay, we'll not sum the weights, we'll sum the ranks. So after assigning the ranks, we have summed for Atkins, we have got it as 73. After Jenny Craig, we have summed it, we got it as 137. So from this we can see that Jenny Craig is ranked clearly higher, right? So like that we have concluded that Jenny Craig is more followed diet, like more uh, apt diet to lose weight than that of Atkins diet. So it is completely different from what we have hypothesized. We have hypothesized that Atkins is the most is the diet which has led to most weight loss, but we have concluded that Jenny Craig diet is the most weight loss based upon the rank. Okay, then coming to kruskal Wallis or H test. Okay, it is a more powerful than chi-square test. It is computed exactly like Mann Whitney, except that there are more groups. So in Mann Whitney we have taken 2 groups, but in kruskal Wallis test, when we have more than 2 groups, we use kruskal Wallis test. It is applied on independent samples with same shapes but not necessarily normal. Okay. Then coming to Freidman Anova test. The Freidman test is a non-parametric alternative to the repeated measures of Anova. Anova test is a parametric test. So it is used to determine whether or not there is statistically significant difference between the means of 3 or more groups in which the same subjects show up in each group. Okay, same subjects, each group. So we have 1, 2, 3 groups, but we have the same subjects. So same subjects means same people we use, and we take means of all the 3. Okay, so whether they are statistically there, whether there is significance or not, we will see based upon that, based upon the means, change in means, difference in means. So applications, we use measuring the mean scores of subjects during 3 or more time points. What does this mean? Did you understand anything from this sentence? Measuring the mean scores of subjects during 3 or more time points. Okay, mean scores of subjects during 3 or more time points. Let us see what it is. For example, you might want to measure the resting heart rate of subjects 1 month before they start the training program, 1 month after after starting the program, and 2 months after using the program. So we have subjects which don't change, right? We are taking the same people, but the time point is changing. The time where we are measuring is changing. Like one is like, first one is 1 month before using the training program, second one is 1 month after using this training program, third one is 2 months after using the training program. So in this to compare the values, in such cases we use Freidman Anova test. So Freidman Anova test, and we can see whether there is significant difference between the mean resting heart rate. So we do not take all the values, we just take the mean of the heart value of the values of the patients across the 3 time points and compare and arrive at a conclusion, okay, whether the training program has worked or not. Okay, then measuring the mean score of subjects under 3 different conditions. Okay, here it is time, here it is conditions. So for this also we'll see an example. So for example, you might have subjects who watch 3 different movies and rate each one based on how much they enjoyed it. Since each subject shows up in each sample, you can perform a Freidman test to see if there is a significant difference in the mean rating of 3 movies, right? Right, we take a group of friends, 4 group of friends, and we ask them to watch 3 movies. So the same person is watching all the 3 movies, and the same person will be rating each and every movie, right? So the subjects are not changing. The only thing that is changing is the movie, right? So based upon the mean of the ratings that they have given, we can see a significant difference, like which movie is doing better. Okay, so that is what we can do with Freidman Anova test. Then coming to Spearman rank correlation test. The Spearman's rank correlation coefficient. So this is the symbol with which we depict the Spearman's rank correlation coefficient, is a method of testing the strength and direction, like whether it is positive or negative, of the correlation, relationship or connection between 2 variables. Okay, so we have only 2 variables. Okay, we only measure the direction and strength, whether it is positive or negative. So this will depict the correlation. It is a relative measure which varies from -1, which is a perfect negative, and +1, which is perfect positive. Okay. Then coming to Cochran's Q test. So the Cochran's Q test is a non-parametric statistical test to verify whether K treatments have identical effects. So non-parametric statistical K treatments is nothing but n number of treatments. Okay, it is named after William Jamel Cochran. Cochran's Q test requires that there are only be a binary response. K treatments means n number of thing. Okay, so when we are taking a variable, okay, we'll see whether it has identical effects or not. So it will be in the form of binary response. We know binary system 0, 1, right? So example, success or failure, that's it. There is no in between. So, and that there be more than 2 groups of the same size. So we'll take more than 2 groups of the same size, and we'll see the outcomes, whether it is success or failure when we are giving something to them. Like any training program, we'll see whether it is a success or a failure. That's it, only 2 things. So the test assesses whether the proportion of successes is same between groups. So proportion of successes, so if 1, 2, 3 groups are there, we have given a program for them, for training program something. So the first group, it's saying that it is succeeded. Second group, from the analysis, we say that it's failed. The third group, it's failed. Okay, so based on this we take a proportion. So the proportion of successes to failure is 1:2, right? So that is what we can analyze from Cochran's Q test. It is often used to assess if different observers of the same phenomena have consistent results. So if the different observers of the same phenomenon like have consistent results, so same results if we are getting, we can just use to assess the same thing in view of different observers. Okay. If you like our video, do subscribe to our YouTube channel. You can also follow us on Instagram at Docshala for dental content and at Docshala Medical for medical content. You can also find us on Telegram. Thank you.